Introduction to Drug Therapy. So this is Unit 2, Introduction to Drug Therapy. These are your objectives and these are your reading assignments. All right, let's talk about toxic effects of drugs. Now, adverse effects, this is a general term for any undesirable effect that are a direct response to one or more drugs or medication. Adverse drug reaction is basically a term that we use in describing an unexpected, unintended, or excessive response to medications given at therapeutic doses. So basically, it mainly describes idiosyncratic reactions. So these medications are given the way they were supposed to be given. There's really no medication error involved, but still the patient develops a reaction. Now, we can classify them into two. So there are two types of adverse drug reactions. One would be an idiosyncratic reaction and another would be an allergic reaction. So idiosyncratic reaction is basically a reaction that's not allergic in nature and it's also unexpected, unintended, and has excessive response to medication, although everything was given the way it was supposed to be given. Now, allergic reaction, on the other hand, it's an immune response. So it's an immunologic hypersensitivity reaction that results from the unusual sensitivity of a patient to specific drug or medication. So this is a type of adverse drug event or adverse drug reaction. Now, allergic responses are categorized into different types. So you have type 1, type 2, type 3, and type 4. Type 1 is also known as IgE mediated. So this usually causes urticaria, angioedema, bronchospasm, pruritus, vomiting, diarrhea, and anaphylaxis. So know that anaphylaxis is a medical emergency. Now, type 2 or cytotoxic, this can cause hemolytic anemia, neutropenia, and thrombocytopenia. Notice that the cytotoxic type basically causes abnormalities in the blood count. Now, type 3 or immune complex can cause serum sickness, fever, rash, arthralgias or joint pains, lymphadenopathy, urticaria, glomerulonephritis, and vasculitis. As you notice, this sounds more of kind of like an autoimmune disease, right? Joint pain is more systemic in nature. It can affect the rest of the body, right? And it can cause inflammation. Now, type 4 is the delayed cell mediated. So basically, an example of this would be an allergic contact dermatitis, so rash, maculopapular drug rash. So some patients, again, after you give them medication, maybe minutes to hours later, they start developing some skin reaction. So the delayed cell mediated is usually a skin reaction. Anyhow, regardless of which type it is, we need to know what to do in cases of a drug allergic reaction. So, first of all, if a patient is receiving the drug, let's say you're in the middle of administering the medication, you gave one and the patient had a reaction, and you still have some more medications to do, does that mean that you continue giving? No, right? You stop the medication. So if for some reason you are, you are assisting the nurse, the registered nurse, and they're giving an IV medication, what needs to happen is that we need to stop the medication. After stopping the medication, right, even if it's just a suspicion, right, you want to make sure that you're stopping it. Now, after stopping the medication, you need to examine or assess the patient, right? You need to check, making sure that everything's okay, check the vital signs, and again, do your head-to-toe assessment. Now, depending on the severity, you may need to call for help. You have to call the provider and basically report what happened, what were you given, when did the reaction happen, and all that stuff, and what was the patient's response, what was your assessment finding. Now, oftentimes, depending on what it is, you may be able to give some treatment depending on the reaction. Now, prophylaxis before administering some medications may need to be given. So let's say it's the only medication to treat whatever condition that the patient has, but we know that the patient is allergic to it. So sometimes we may give them pre-medication or prophylaxis or preventative. So medication that will prevent them from reacting or maybe from a more severe reaction, just to make sure that we can administer that medication for the patient. And so we will have to just weigh risk versus benefits, right? Anyhow, next would be patient education. We need to make sure that we educate the patient, and hopefully they can report any any weird sensation, anything that they're feeling during, after they are receiving medication, especially if we're going to send them with a new medication. Now, again, remember that if the patient starts having anaphylactic reactions, so this usually involves swelling of the face, throat, neck, right? It can impair the airway of a patient. This is considered a medical emergency. So call for help. If I were you, I would even just call the code blue button just to make sure you get all the help that you need. Because again, anaphylaxis is a medical emergency. So adverse reactions, some drugs, regardless, of what it is, sometimes it can cause tissue or organ damage. Most commonly, as I mentioned, especially when it comes to allergic reaction, patients can have dermatological reactions. So any new skin changes or rashes, it can vary, it can be very mild as a rash, but it can also develop into ulceration. So patients can get dermatological reactions, super infections. So again, this causes a stronger microorganism infection. This often is related to antibiotic use or maybe misuse. Blood dyscrasia is basically a problem with the blood count, so abnormalities in the different blood cells. Toxicity, depending on what drug it is, it can be toxic to different organs. Alterations in glucose metabolism, specifically one of the most common drugs would be your steroids, so it can increase the glucose levels. Some medications can actually alter the electrolyte levels. It can increase or decrease certain electrolytes such as your potassium, your sodium, your calcium. Some medications can cause sensory effects, so some medications can lead to hearing loss or maybe ringing in the ears. There are medications that can cause neurological effects such as numbness and tingling or loss of sensation. And there are medications that are teratogenic, so they are known for their teratogenicity. So teratogenic or teratogenicity means basically a negative effect to the development of an unborn fetus. So again, this pertains to patients who are taking certain medications who are pregnant. So again, this can cause malformations or defects, right, in an unborn child. All right, nursing process in drug therapy and patient safety. So the nursing process includes 5 steps. You have assessment, nursing diagnosis, planning, implementation, and evaluation. So what is the nursing process? So nursing process is basically a research-supported framework or organizational framework for professional nursing practice. So this ensures that we deliver thorough and individualized quality nursing care to patients. So it basically provides a standard, right? A framework that we have to follow to ensure that we're giving the best care possible. Now, this requires critical thinking, and this is ongoing and it's constantly evolving. And it doesn't mean that you're ready in step number 5 that you don't go start all over again. So it evolves, it's ongoing, it doesn't just end after you evaluate. Sometimes you may need to start all over again depending on what's going on with your patient. Anyhow, step 1 is assessment. So this is the part where nurses are collecting data. So this is when you're asking for their name, you're assessing, and so on. Number 2 would be the nursing diagnosis, which actually now we are changing it to human statement or problem list. So this is when we as nurses are identifying problems, right? What is going on with the patient? What is our priority problem? So what are we concerned about? Again, we used to have the nursing diagnosis, but now we're actually going away and trying to be a little bit more current by stating the actual diagnosis, medical diagnosis of the patient, or maybe specifically stating the problem that we're seeing. Now, planning. So this is when we're actually planning, trying to come up with some goals and a timeline that we're going to follow. Implementation is the action part, right? This is when we actually implement or we do what we said that we were going to do when we were planning it. So this is when we initiate treatment, administer the medication, and basically apply the interventions that we said that we were going to do when we're planning it. Now, evaluation is basically when we check for therapeutic response. So basically, we implemented it, we did our intervention, and we go back and check on our patient again. Did the patient get the actual response that we expected them to have? Right? Again, kind of like the example that I gave you guys earlier, right? If you're giving a medication for blood pressure, when you go back and check the patient, did the medication actually lower the patient's blood pressure? Is there a response? Is there a lack of response? Or maybe is there an adverse reaction, right? So again, that's your 5 steps of the nursing process. Now we are going away from that, and now we're more emphasizing the clinical judgment model. So basically, it is very similar. And anyhow, so the clinical judgment model comprises of 6 steps. So number 1 would be recognizing the cues. So this is basically when we see what is going on, what is abnormal. We're noticing, right, the cues, the patterns, right, the signs and symptoms. And then after that, we analyze those cues, right? We start thinking, what could be causing, right, the symptoms of my patient? Then we prioritize the hypothesis, meaning what is the likely cause? Now we're really trying to narrow it down, right? What is the problem? We're identifying it, right? And then we generate solution based on our hypothesis. Let's say we think that a patient has hypertension, then what are the interventions that we need to do for patients with hypertension? Then next, we actually implement it by taking action, right? So if we said we administer the medication, this is when we administer the medication. And lastly, we evaluate the outcome. So as you can see here, they're very comparable. Some of the steps are very similar. But again, we're trying to go away from the nursing process, and now we're more focused on the clinical judgment model. All right, prevention of medication error. So as nurses, right, we're humans, so sometimes we make mistakes. We can actually make mistakes. But that said, most of these errors are preventable. Anyhow, so there are ways to prevent errors, but first we need to examine, right, what are those errors? What is causing those errors? Anyway, so first let's talk about to err is human. So in 1999, there was a report by the Institute of Medicine, right, called To Err is Human. This basically brought the medical errors to public's attention. So basically they're saying that in this report that there are so many errors that were actually preventable and caused 7,000 deaths per year. So basically 3% to 6.9% of patients in the hospital experience some sort of medication error. Now, there were 2 follow-up reports from the IOM which found that there were no significant changes in the rates of preventable errors. So that was actually a concern, right? Why are these preventable errors happening? Anyhow, so something to really know when it comes to medication errors. So medication errors are actually very preventable. Medication errors are common causes of adverse healthcare outcomes in the clinical setting. Now, the drugs commonly involved in severe medication errors include drugs that affect the central nervous system, so usually sedatives, also anticoagulants that can cause some bleeding disorders, and chemotherapeutic drugs. As we know, they have very severe adverse effects. Now, there are medications that have more potential for harm, which are now called high alert medications. Other ways to basically raise awareness and hopefully prevent medication errors are the SALAD or sound alike, look alike drugs. So there are medications that sound alike and they actually look alike. So that's why it's very important that we check on those medications to make sure that we're actually giving the right drugs. There's it's also they're also known as the look-alike, sound alike. So as either Lassa or Salad. Anyhow, most medication errors again occur not as a error of an individual person, but often because of a breakdown in the system. Again, it is not usually because of an individual, but mostly it's because of a systemic error. There are ways to prevent medication errors. So one of them would be reporting of errors. So that ensures that those errors are investigated and we really get to know what caused those errors. Reporting potential errors, so we don't wait until the error happens. So even if it's something that maybe almost happened, right? Because if it almost happened to you, then there may be a time that it's gonna actually happen. We need to make sure that we take the non-punitive approach when it comes to medication error reporting. or this is also known as the just culture. Basically, you report yourself and you don't get in trouble for it. Now, that's a little questionable because of certain events that happened over the last couple of years. I'm not sure if you guys are familiar with the nurse. Her name is Rodonda Vaught. She is a nurse that actually committed a medication error. I'll probably show you guys a video in class at one point. But anyhow, so she basically, I think she reported herself. I can't remember the exact thing, but it actually caused you know, a adverse reaction, and she basically got indicted for it. Anyway, some other ways are the CUSIN initiatives. Some contributors to the errors. Errors can happen during any step of the medication process. So again, it's not usually an individual's fault, but sometimes it's when during procuring the medication, right, obtaining those medication, prescribing it. So when the provider is actually prescribing it, when the medication order is being transcribed, sometimes when it's being dispensed, or when it's being administered, or sometimes when it's not being monitored or failure to monitor. There are different things that can contribute to error, such as organizational issues, staffing issues, maybe educational system issues wherein the staff don't really know, or they are not knowledgeable enough or competent enough to prescribe these medications. Now, there are also sociologic factors, right? So unfortunately, sometimes depending on the location, the resources available, the less resources that you have, then the likelihood of committing, there's a higher likelihood of committing errors. And another thing is the use of abbreviations. So make sure, if we can, avoid using abbreviations. And if we do use abbreviation, that we need to make sure that they're approved abbreviations. We can't just make up your own abbreviations, or maybe abbreviations that can be used or interpreted differently. You don't have to memorize this, but basically you need to understand, right, these steps. These are strategies or ways to minimize or prevent errors. So again, awareness and speaking up. If you notice something that maybe is the concern for potential errors, you need to speak up your mind. You need to report it. Now, fortunately, over the last years, we now most places or facilities have computerized systems. So now we are able to have computerized prescriber order entry, or CPOE. When back in the day, we used to have to decipher the doctor's handwritings, and sometimes they're not necessarily easy to understand. Now we have the barcodes and scanning devices, so please use them. There's a reason why they're there. So please scan the patient, scan the medication, and make sure that everything is matching. Now we have automated dispensing machines such as the Omnicell. Again, it is important to have effective and clear communication. And now there's multiple system checks that we need to make sure we are following. Also, prescribers now must write legibly. And again, that's usually not a problem because now they have to do it electronically and they have to type it. So it's really easy to understand. Pharmacists, right, they need to be current with their knowledge in literature, and they're also available for consultation. Also, nurses need to always check the medications or the orders 3 times before giving the medication. That's why we have the 3 checks. The 6 rights, so now it's actually 8 rights of medication administration should be consistently followed. We need to make sure we're assessing the patient. We're using 2 patient identifiers when we're administering medications. And also we need to not administer a medication if we did not prepare it or draw it ourselves. We can't just accept a medication in a syringe without knowing what it is and give it to a patient. We need to be the ones withdrawing or preparing the medication. Also, we need to avoid verbal or telephone orders as much as possible, unless of course if there's an emergency. We need to make sure that we're repeating. If we get a verbal or telephone order, we need to repeat back the order, read back the order, right? To make sure that that's what the doctor prescribed. Also, if needed, we need to spell the drug names aloud. We need to speak slowly and clearly. We need to list the indication next to each other. And also, we shouldn't be assuming anything when it comes to a medication order. So if it's not specified, we don't assume. If it's not clear, we don't assume. We need to clarify it with the provider. We shouldn't be hesitating and asking questions, especially again when we're in doubt. And again, do not try to decipher. If you don't understand it, don't try to make things up, right? Just call the prescriber and clarify what it is. Also, again, abbreviations. Do not use unapproved abbreviations. Never use trailing zeros. So again, especially with medication. So let's say instead of, if the order is 1 milligram, don't put 1.0 milligrams. Just put 1 milligrams without the trailing zero, because again, that extra zero can be misread as 10 instead of 1. So again, we end up giving tenfold the actual prescribed dose. Also, always use a leading zero for decimal dosages. So let's say if it's a 0.25 milligrams, you don't write 0.25, you actually have to write 0.25, right? Because sometimes if they don't see that decimal point before the 25, they may actually misread it as 25 milligrams, and that's actually a lot, right? And so make sure that always use a leading zero. Now again, take time to learn anything, the technique, the dosages of certain medication, verify the records, read the labels, use generic names. So from now on, I know some of you are probably used to using brand names, but make sure you're using generic names, because some brand names sound alike and look alike. Also, always listen and honor any concerns expressed by a patient regarding medication. So if a patient's telling you they don't feel good, they're having this reaction, don't just kind of like, shove it under the rug and say, it's okay, you'll be fine, right? Evaluate your patient. Take them seriously when they have concerns. Now, check for allergies. Check for patient identifiers. Know where to get information. How to prepare the medication. What are the common side effects? Use current and reliable resources. And again, for certain medications, the high-risk medication needs to be double-checked with a secondary licensed person or a nurse. And also, we have to minimize interruption when somebody is actually preparing or administering medications. Medication reconciliation. So this is basically a continuous assessment and updating of patient medication information. So this involves verification, clarification, and reconciliation of medication. So the process in which medication are reconciled at all points of entry and exit to or from a healthcare entity. So meaning whenever we admit a patient, or maybe we transfer them to a different department, and then right before we discharge the patient, we have to recheck and verify the medications that the patient have. And basically the provider or the doctor has to double check and indicate if they want the patient to continue the medication, to make any changes, and so on. So that makes sure it closes the communication gap, and we need to make sure that we're not, omitting a medication or maybe double ordering certain medications. So basically, the patients will provide a list of all their medications that they're currently taking, and that's including herbals and over-the-counter drugs. Then the prescriber assesses the medication, and they basically decide whether to continue it or not. So again, this should be done at any stage of the healthcare delivery, initially during admission, any status change, if they change into a more critical condition, or maybe they're now more stable, whenever they're being transferred from one unit to the other, or maybe from another facility to another, and also at discharge. So again, the latest medication list should be provided to the patient to take to his or her healthcare provider. So again, so they know what changes we've made, what things did we give them to while they're in the hospital. All right, I think at one point I mentioned the 3 medication checks. So please memorize this. You will see this often, right? So there are 3 medication checks that you have to remember. So number 1 would be during first contact when pulling the medication. So as you're pulling it out from the drawers or maybe the medication dispensing machine, right? You're checking that medication. So on first contact when pulling the medication. Now, after pulling the medication, as you're preparing and opening the medication, you're gonna check it again, right? You check everything, make sure it's the right drug. Is it expired? Is it the right dose, right? And then when you're in the patient room, right before you give that medication, you check again, right? So prior to administration. So those are your 3 checks. Please memorize those because you will see them often. Also, another way to make sure that the patients are gonna be safe, right, to prevent some preventable errors or maybe some adverse reactions, we need to double check some high-risk medications. So double checking meaning requiring another licensed person to co-sign those medications with you. So these are the medications that tend to be double checked. So the acronym that you have to remember is HIP-CT. So heparin drip, insulin, patient-controlled analgesia, chemotherapy, and thrombolytics. So these medications are high risk, therefore they need to be double checked. So heparin drip is an IV continuous form of heparin, which is an anticoagulant, so it can cause severe bleeding or basically hemorrhage, right? Insulin, now insulin sub-Q, nowadays we don't really double check, but if it's going to be given IV, it needs to be double checked. Now, patient-controlled analgesia, these are basically pain medications that are controlled substances wherein they're in a machine and the patient has the ability to press that button. Now, it doesn't mean that all pain medications should be double-checked. Specifically, patient-controlled analgesia or PCA should be double-checked. Chemotherapy, and again, some of us, or probably most of us, are familiar with chemotherapy. These are highly toxic to either healthy and unhealthy cells, right? So that's why they need to be double checked. And last but not the least, thrombolytics. So thrombolytics are basically medications that break down clots, and this can cause severe bleeding. Therefore, this is also a medication or a type of medication that needs to be double checked by a secondary licensed person, usually another nurse. And then in addition to this, obviously, if we're having a hard time calculating certain drugs, or maybe if this medication can be quite lethal, even a small increment of doses, then it's always better to have somebody, another licensed person, to help us double check the drug, even though it's not required. And again, right, you have to memorize this, the 8 rights of medication administration, which is the right patient, right drug, right dose, right route, right time and frequency, right documentation, right reason, and right response. In addition, another responsibility of the nurse would be patient education. So ideally, we want to educate our patients before we give the medication and also after, just to kind of re-emphasize what we've given them, right? And so patient education is our responsibility. In addition, we also need to inform the patient and the family of what they're getting, right? Why they're getting what they're getting, and also any potential adverse reaction that they may need to inform us. And obviously, families can be notified depending if they are either the guardians or if the patient gives the consent for you to give information to the patient's family. That said, as much as we are responsible for a lot of things, the patients are also responsible for certain things. So they're responsible of getting themselves informed, so getting some knowledge. So as patients, they need to also be a little bit more accountable, right? So they need to be informed. They need to advocate for themselves and ask questions. And they also need to report any signs and symptoms or any concerns that they may have when they're getting medications. And again, we need to encourage them to speak up, because some patients, they'd rather not say anything. But again, this is when it comes to their safety. And at the end of the day, they're the ones going home with those medications, right? So they have to ask those questions. They have to know. The minimum is knowing why they're taking it, right? When they should be taking it, and so on. So again, make sure you're encouraging them to speak up, to ask questions, and to really report anything unusual, any signs and symptoms, or any concerns that they may have pertaining to the medications. All right, so what happens if we make a medication error, right? What do we do next? Other than obviously making sure that the patient is okay, we did everything, we took care of our patient. Another responsibility that we have is to report the medication errors. So we need to report the error to the prescriber, right? So they know that, whatever happened when they prescribed the medication. And this needs to also go to nursing management. We need to document the errors according to policies and procedures. And when we're documenting, we need to actually provide factual documentation only, meaning it's not biased, right? Not not based on how we feel, but based on the events happen. So we need to include the medication, so what was administered, what was the actual dose, any observation when it comes to the changes in patient condition, and also if we notified the provider and if there were any follow-up orders. We can't just document what we feel or omit any documentation. So again, it needs to be factual documentation. In addition to that, we also are required to report to certain entities. And so certain external reporting of errors include reporting to the United States Pharmacopoeia Medication Errors Reporting Program. Sometimes hospitals voluntarily report their errors to MedWatch, which is sponsored by the FDA, Institute for Safe Medication Practices, and then JCO, or the Joint Commission. So that's it when it comes to the introduction to drug therapy. Thank you.